Looking for financial insights you can trust?
How do you protect yourself as an investor? What's the strategy?
I think it's really simple. I think you just want to be diversified in your portfolio.
The Payne family brings real-world experience to every conversation.
Well, I think that's the problem right now is, right, a lot of people that are close to retirement, they're taking so much risks. And if we do get a big sell-off, it could derail their retirement.
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.
Listen, all you New Yorkers. Taxi. Okay, man, we're looking around.
This is the 77 WABC minicast.
Dr. Michalos is with us. Good morning, America's doctor on the line. How are you?
Good morning, Bo, and it's great to be on the show that's filled with facts, good humor, and great music.
Oh, well, thank you. Doctor, I have two questions for you. And I want you to I'm going to lay the questions out and then let you go. You tell us. First question. This week, the administration adjusted the vaccine recommendations, especially for hepatitis B. And that's going to do. And then Trump said later in the week, yesterday, that he wants to make sure that the CDC, he's ordered a review of the entire childhood vaccine schedule. He says the United States is an outlier, and he points to nations like Denmark or the Danish nations where they have fewer vaccines for young children. That's number one. The second, so what do you think about that? And should people be alarmed, especially with this new recommendation from Health Secretary Robert Kennedy Jr. and the others at the CDC on hepatitis B? Number two, Obamacare. Subsidies. Democrats are having a cow. In 9 days, the subsidies expire. They're demanding that everybody jump to it and deal with these sunsetted policies that they put in place that were COVID-era subsidies, and so just Obamacare. They're your two questions. What do you have to say, good doctor?
Okay, well, first of all, people have to understand what hepatitis is. It's a viral infection that attacks the liver. And who gets hepatitis B infection? It's people who basically have unprotected sex with people who have hepatitis. It can be mother to child, needle stick injuries, whether you're a healthcare worker, people who share needles, people who actually have hepatitis and share razors and toothbrushes. And the issue is that if you are a mother who does not have hepatitis, so the other issue is that 58% of the women in the United States in a 2019 study who had hepatitis B were not born in the United States. So that was one of the first issues, because hepatitis B is actually endemic in other countries, in Africa, the Middle East, in South America, in Colombia, Peru, Venezuela, and big time in Brazil. So that's one of the issues. So now they're saying, well, if you're a mom in the U.S. and you have a blood test and shows you do not have hepatitis, and in your household you're not having people who are using IV drugs or having risky behavior that will get you hepatitis, why do these kids need to get the vaccine when they're born? So that's where the issue is, and that's where the ACIP, which is the advising committee, voted 8-3. So wait a second, we don't exactly need to vaccinate these kids immediately the day they're born. You can think about it and have a discussion with your doctor, and when the kids are 2 months or older, then you can decide whether to treat hepatitis B, because hepatitis B has no cure, so it is an issue. So that's really where all this came from. I believe in vaccines. Vaccines are incredible. All started back in 1796 with Edward Jenner, who vaccinated for smallpox, and that changed the world. And you need to vaccinate for things like mumps, measles, rubella, polio, tetanus. It's quite amazing. Louis Pasteur, who taught us how to, sterilize our milk, also is the guy who invented the rabies vaccine. So it is a good thing. So basically, people are just starting to question: do you really need to vaccinate, if a mother is tested and doesn't have hepatitis, does the kid need to be vaccinated? Because the kid isn't having, unprotected sex exposed to saliva, blood, and other things that won't really allow. So it's a much lower risk. So I think that's why they started with the hepatitis B issue. So that's to clarify what the thinking was and who's at high risk. It's just like saying if we had an AIDS vaccine, does a newborn baby need to immediately get an AIDS vaccine? So that's really where the thinking is with that. So I think that having basically individual-based decision-making with their physician to decide on that's a high risk. Something like polio, measles, mumps, tetanus, that's different. Those things are amazing, and they've saved so many people from death and from disability. Just think about how polio polio vaccines changed the world. So I think that, in a household, I think people should, be tested. And if you have people in your household who have either active hepatitis, have evidence of active hepatitis B, then, your baby probably should be getting a vaccine because they may be potentially exposed to bodily fluids that may give them the disease. So that's
okay.
The first thing. Next, I'll go to Obamacare if you want.
Obamacare. Okay.
First of all, we have to understand what these subsidies are. Basically, to start off, insurance company profits have gone up like about 1,000% since that time. Because basically the government is guaranteeing, let's say insurance costs $1,000 a month. These subsidies are that the insurance companies are getting upfront $500 a month. So whether you use the insurance or not, they get the $500. It's estimated that about 12 million people who are on Obamacare aren't even using the insurance. But the insurance company still gets the $500. So that's one of the big arguments. The other issue is that a lot of these plans have $5,000 deductibles. So the insurance company doesn't even have to start paying out till the person themselves meets that deductible of $5,000. Now, what has that done to doctors' offices? People don't meet their deductible, so the doctor's offices now turn into a collection agency or the hospital turns into a collection agency until they get that $5,000, and then the insurance company has to pay out. So it's a big win-win for the insurance companies. There are other options where you don't have the middle man who has to respond to shareholders and show quarterly profits. For example, these Christian sharing programs where people pay $319 a month for a family of four. Yes, they have a deductible, and then basically they share the expense. And that's how, like Blue Cross Blue Shield started. Everybody in a community put in $100 a month, and when somebody got sick, they paid for it. So you don't have this middle man who's getting a 30% cut of each time you go to the doctor, and that's one of the issues. And the other thing is that if you follow the money trail on opensecrets.org of the politicians and how they get a lot of the money, you can see some of the biggest recipients of money from insurance companies. So like one of our friends always says, follow the money. And we already have an existing Medicare system that works quite well for people who are 65 and older. And that system doesn't have a middleman getting a 30%. Basically, the system exists. So there are ways to strengthen that system that already exists. So instead of taking those subsidies, if you strengthen the Medicare system, then allow people who are 50 years old, for example, to buy into the system and pay $700 a month and have what I call a fair care card, and also do things like risk adjusted where smokers would pay 20% more. And also, you can also give Medicare a 501c3 status. So if billionaires want to contribute to various causes, they can contribute to that fair care system. Now, the Trump Health Freedom Act, basically what they want to do is basically be able to shop for insurance across lines, still cover pre-existing conditions, and basically give people more control and be able to negotiate. Like right now.
Now, those things that you just mentioned, Doctor, were what Republicans were trying when this health care scam called Obamacare was being negotiated, that they were trying to get in. And I'm going to just go straight political because that's what it is. It is a political program. The Democrats told Republicans, hell no. We don't want your input. We don't want talk about insuring across state lines. Neither party really wanted tort reform because of the pressure from the American lawyers that would also mitigate the malpractice end. So Democrats, and we're coming into the holiday season, in 2000, they passed this in the holiday season on Christmas Eve when everyone else busy with their presidents and opening up. Democrats, without a single Republican vote, passed this Obamacare scam. And all of the promises that were made with it have never, ever been delivered. In fact, everything they promised has turned out to be exactly opposite. Healthcare costs didn't go down, they went up. And you all know the rest of it. You couldn't keep your doctor and the like. So I just wanted to add the political component into this as well. The very things that you're talking about, Democrats refused to put in this plan because they did not want any input from people that had other ideas.
I agree with you 100%, and we also need transparency in pricing. Why does an MRI in a hospital cost $2,000, and then you can go privately on the outside and get it for $500? And the other little dirty secret that nobody talks about is the reason why hospital prices are so high is because they can't charge different people different prices. So they have to charge the maximum amount to everybody. Why? Because those people who actually end up paying the maximum amount, they end up subsidizing everyone else. So it's basically a form of socialism where that those people who actually are paying the bill then subsidize all the people who come into the emergency room and say, I don't have insurance, or they a lot of times say, I don't have an address, and then you have nobody to bill and nobody to collect money from. So that's part of the system because the hospitals have to take the burden and take everyone. Everyone has to be treated, but nobody cares that the doctor on call, for example. I know many doctors, including myself, who've given away millions of dollars in free care because if we're voluntary attendings at a hospital and we come in and see people, you take care of them, you operate, you stitch them up, you never get a dime, you'll never see a dime. So that's part of the system that nobody talks about, and a lot of doctors, small mom and pop shops close up because eventually you can't keep giving away free care like many of the voluntary doctors around the country are doing. And that's why now hospitals have to find people and pay them to take call at hospitals. So getting access to specialty care exists. So part of the problem with Obamacare is it's a card without care because many hospitals and many doctors won't take it because they're not going to do an exam that pays $25 for a follow-up visit, or they're not going to do a hernia operation and get paid $300 when just the equipment alone and the materials needed cost $500 or $600. So we need immediate transparency in healthcare to be able to create a competition so various centers can charge, what is fair and appropriate and affordable, because we have a system that's a sick care system. We need to do more on preventive health and doing more with anti-aging and trying to keep ourselves younger and healthier and improve our health span so we don't end up needing the hospital and hospital care. But, there are alternatives.
That is one of the things that I want to bring you back on to speak about. Sadly, we're out of time for this segment. But Dr. Michalos, I thank you. These two very important issues, and I think you have clarified a lot of them for people in the way they should be thinking about them. Especially, I want to say this whole vaccine issue. You have brought amazing clarity to that. And I hope people go back if you missed it, go back if you need to, and refer to this interview to help get the word out of what this is really about. Dr. Peter Michalos, America's doctor.
Thanks for always getting the truth out on your show.
Thank you for joining us.
The James Golden Show on the Red Apple Podcast Network.
Listen to this podcast now
on the Red Apple Podcast Network. The Idea Gen Global Podcast with George Sifakis.
I'm George Sifakis. In a world overflowing with noise, there is one forum where the world's smartest voices connect, where visionaries sit at the same table as innovators, and great minds don't just talk, they act.
Download all of Red Apple Media's podcasts right now through your favorite podcast platform.